things, right?
Okay, welcome to What Happens in Vegas. Today we've got Leah back on here, Dr. Leah, my savior, and also we're going to
That's a
start
little
telling you
much.
about our course. What?
So that title's a little much.
My savior? She saved me from a lot of things,
Yeah.
okay? Like, I'm talking in the middle of the night when my heart was going crazy and I thought I needed to go to the hospital because of my infected toe, to, I don't know, when I couldn't move my neck for multiple times from Lyme disease, to when my bowels decided to stop moving and my ileocecal valve bulged out. Like everything. I mean, you've come with me to like 4 hour long appointments. When I got my tongue tie cut,
Watched
uh,
it.
like, what
I
am I
have
missing?
video of that.
Yeah, like, I mean, that, so yes, I would say my savior, my, like, I don't know,
I've
I'll
just been
start
there for a
crying.
lot.
I'll start crying if I start really saying how I feel. Um,
No,
so I don't
thank you for
know.
that.
I don't think anyone else has a person like Leah in their life like I do. I
Okay.
feel very lucky.
We should cut that part.
Anyway,
How to
okay.
make me uncomfortable.
Anyways, grateful. Hashtag grateful. I'm just kidding. Um, no, but seriously, we've been trying to already have a lymph course for you, but my body keeps not cooperating. But guess what? We are just going to power through and we're going to get this out to you. But with every problem that
It's
happens to
almost,
me, I think we get like a better idea for what we really want to give people, right?
I think you just in your mind have to be told over and over again why this is so important or something,
know.
because otherwise it doesn't make sense why this is all happening to you all the time.
Yeah, I agree. And then you're there with me to help sort it out. And I don't know, because okay, if I think about it, the way that we treat people, like, it's so like in depth, and like no one else can really feel, or they don't try to feel like small changes and stuff. So I don't know, if I hadn't have met you and we hadn't have come, like, you
Yeah, I
hadn't
mean,
have.
I think, well, if you're talking about everything happens for a reason. Yeah, I think, I mean, at some point this probably would have affected you. The Lyme would have reared its head again. And I mean, luckily we did meet and you did teach me everything that I know. So that's super helpful. And then from there, it's just been kind of trial and error, really. And it helps that you're really good at knowing your body, because I mean, I wouldn't know if I was helping you if you weren't like, oh, this really helped, right? So I think part of it is that it all kind of happened at the right time for this to now hopefully be coming to fruition and us finishing this course so that we can help other people who are in the same situation. Because I still feel like you are the one that gives me confidence to keep treating, because you're like, oh yeah, that feels good, this really worked, this, put your hand here, do this, do that. So if I didn't have that, I feel like I wouldn't know if I'm doing the right thing for people, or if something's working or if something's not working, or to have the confidence to think, oh, this might be good for them because it's worked on you. So as much as you're saying like, oh, you've really helped and this and this and this, I think part of it is that you've given me the confidence to try different things, and then also helped me along to say what's working and what isn't, so then I can try those things on people. Because otherwise, if truthfully, if we didn't have each other, then nothing, I don't think that this would have grown either way.
No, I agree. But, and it brings up a point to me thinking about other people, because everything I had to go through, even to understand it, and even to like, be like, that's not helping, or figure, like, okay, so already went to chiropractic college where we learned so much anatomy, so much theory, like we learn and learn and learn and learn, and then applying is like completely different. But then like being the actual patient, to like feeling what it feels like to be the vulnerable one, to be the one getting treatment and having to give feedback. And I feel bad for people that have no background in any of this, because honestly, it doesn't even make sense how the different parts of our body are connected, or what we found with right? Like even just figuring out that like, okay, once you rule out all pathology for your heart, when you're having heart palpitations, you most likely have stuck deep lymph.
Right. I mean, and that's scary to tell people because they don't want to believe you. But because you've experienced it and obviously ruled out scary things, then working on it and knowing what works has allowed you to be confident to tell people that.
Yeah, but also this is something else that I've realized for myself. And if you have any chronic complex illness or lymphatic problems or heart palps or just weird symptoms that don't go away or ebb and flow, like no matter like what it is, it's not scary, serious if you've gone through it numerous times and you haven't, you're still here. Like, so even wrapping my own head around that and trying to explain that to other people is like hard. So what we want to do is have this course, like we'll have like different clips too to send them, and then explain it to them again, and then treat it. You have to like show.
Yeah,
it's like repetition.
That's what I was going to say. I think that's actually something that I mean, maybe once again, this is why the same things or similar things keep happening, to just show you how much repetition one needs. Because as somebody who understands the science, understands the background information, understands the body, has treated for 15 years or however many years it is now, like yourself, and yet you went through all of this and you still needed to remind yourself anytime these things came up, like I can get through this is how I do this, like and refiguring out every single time, okay, wait, no, I have to go back to what I did before because that's what worked for this or that's what worked for that. The number of times you've said that you've had to repeat it or we've had to rework on something, and you don't want to almost believe that I don't want to say it could be that simple because it's not simple, but like you don't want to believe that maybe working on this stuff could be what really helps. But I feel like it's been proven in the last 3 years, time and time again, that when we came back to that was what helped push along things, as opposed to just relying on, supplements or just relying on, other different modalities. It's like it's complex and it has to be all these things combined. But I do think you've really appreciated the manual part, and enough where you can now say to people, this is what you're missing. And this is why it's important to put something together for people, because like you said, people don't know this information and they don't know where to touch. They don't know what to look for. It's really hard. It's hard for people who've been doing it for 10 years. So you can't expect someone who's never felt something or isn't in tune with their body or doesn't know what things are supposed to feel like to just get it. But it's that repetition that can really make a difference.
Yeah. And so even in the course, we're trying to show people, okay, here's some self-manual stuff. Here's something like your partner could do on you. Here's multiple different tools. If you don't have one, you have the other. Here's ones that we really suggest that you should have. Here's some topical suggestions, internal suggestions, dietary suggestions, but then also like the stretches that go along with each body part. Because if you do, our whole thing is like, even just this one loosening of your deep lymph is not going to be enough if you don't do like multiple parts or find which part you're better at getting relief from, right? So there has to be some sort of like responsibility on the actual patient to figure out, we're giving you the tools, but which one works well for you, which one's the most practical for you, and then
like
we
you're
can
saying about your dad with the ball working better for him. Like your mom uses the ball to release his fascia. It's hard for her to get her hands in there and know what to feel, but the ball is a guide for her, and that makes it easy for her to help him and for him to get relief.
Yeah. And so a big part of people, if you're listening in, we're talking about one of the tools, which is like one of these balls that helps loosen the fascia. And we'll talk about the fascia a lot, because what you'll see out there is a lot of lymphatic courses that are more referring to more superficial drainage of lymph. And what we're talking about is deeper drainage of lymph around organs, like the stuff that has to come drain to the top and meet up with the superficial lymph and then clear through the lymphatic duct. And we go into all of that in the course, but certain tools are going to work better for certain people. And so one of them is one of those, it's a simple ball that has the little jagged,
like
little bumps.
Yeah.
Yeah, acuballs.
Acupressure points.
And rolling that over the lymphatic drainage parts, but like in a way that affects the fascia, is going to be a big difference in what we're showing you in this course than what you're going to see for the gentle lymph pumping or rebounding. All of these things can be helpful. It's just when I was sick, if I just pumped those things, like you saw how inflamed my lymphatic was. Like, I mean, that's just a joke. It's funny to think about, like, just doing that.
Just
and I tried it.
Yeah, it's not that you didn't try it, it just didn't work for you.
No, it didn't.
And so, and you're one of, a lot of people have similar issues, so that's why you're saying, if I need to work on my deep lymph, then it's not just a me problem, it's a global problem.
Yeah, and we work with a lot of athletes too, and people talk about lymph, and if you move, it should be okay. But that's a big thing we talk about is we're seeing these athletes, and they move more than anyone on this earth. Like, so why is their lymph stuck? So can you, like, what are some of the, like, stuck areas that you're seeing, like, in general, even maybe that we never saw before? And I don't know if and I think that they were present, but, like, what are we focusing more on?
I think that's a good point to make. It's like, it's not that these points weren't present before, and it's not that people aren't necessarily working on these points as practitioners. It's just that the intent of what you're doing changes.
Yeah.
And I think that's what we've done. So obviously the biggest point that people talk about is the, like, upper trap area and front of the chest under the collarbone area. So those areas are huge for the actual opening up the drainage points so that the lymph can get eventually out of the body. So those areas obviously get very stuck on people and on the general population, because everybody has the classic, like, tech neck, like, we're always looking at our phones, we're driving, we're sitting, we're at our computers. So everybody's getting more tension in those areas in general. So those are always tight points for people, but people aren't realizing that those tight points are actually blocking their lymph from draining out of their body, and their waste systems from getting out of their body. So those areas are huge. And that's, I mean, like you said, in the athletic population we work with, those are still big points because they're, hunched over with a hockey stick. So it's still a point of tension for them. Other areas for people that we've noticed, I mean, a lot of abdominal stuff, which we just worked on with you again. Huge area that I think is probably missed in a lot of practices, because it's kind of like we don't touch the abdomen. We touch the arms, we touch the legs, we touch the neck, we touch the back, but we don't touch the front. But the abdomen is such a crucial point because everything kind of converges there from lower body to upper body. So I think in the last year and a half, 2 years, we've been working a lot more on abdomens. Like, not that we didn't work on it before, working on hip flexors. And actually, one thing to point out is that I think you were always working on the abdomen, even when you weren't talking about a lymph perspective, because that's one thing I remember noticing when I first started working with you was, in school you learn, okay, you work on the hip flexor and that's it. And then I remember watching you treat someone and you were going up further and you were going into the, rectus abdominis. Like, it looked like you were going into different parts of the abdomen, and I was moving the leg still and working on that, or moving the arm still. And it was something that I remember consciously thinking, like, oh, that's weird. I never would have thought to work on those areas. So it's not that you weren't working on those before, but I think now with more, like we just said, with more intent, you're working on, like, actually thinking, okay, this fascia is restricting lymph from moving, and it's restricting anything from the lower body getting to the upper body, which, like I said, everything is draining through here. So everything has to come up. So that's a huge point of tension for people. And I do think, like I said, it's a missed point. And even for people having, bowel issues or abdominal symptoms, it can be really relieving to even do some self-work on that, because like you said, you just want to make space for things to be able to move. And one of the biggest things that we noticed with you is when things are moving, you're hearing gurgles, and that gives you relief. So it's kind of cool because that was an actual
tangible
tangible thing to compare it to. It's not just like, okay, do you feel better? We would hear a gurgle and you would say like, yeah, that feels a lot better, or I feel calmer, or I feel things moving.
I also had that neurological burping for a while, which some people
that
get.
was also my favorite.
Not
many people have that.
Like for us, when you can get like the body's giving you like straight feedback,
Symptoms.
Especially when someone isn't like myself, where I can tell you specifically if you're on the right spot or not. Like, I mean, it's so helpful as a practitioner.
Super helpful.
We always test and retest, right? So we're always retesting to see if whatever we found that was stuck is moving. So like at least we have feedback from the body that way, because some people are so out of tune with their body. So one thing that I'll add right now is like, I don't know, try to start to listen to the body. Like, you know,
yes,
listen, you can hear if you sit quietly and see if your bowel movements are happening, or like massage it. Like, so I think that's something in the course that it's just like introspection, like not to the point where you know every organ, but lots of people don't have that. Yeah.
No. And I mean, the number of times people say to me, does it feel looser?
Yeah.
How do you don't feel it? Like,
yeah.
I mean, maybe it's just for them, it's like, do I have pain or do I not have pain? So for them, it's not about tension and less tension. But it is crazy to think about, because and I always tell people like, things are going to feel like different to me and better to me, but I think then you will feel the relief eventually. So yeah, no, but it's true. Some people don't feel it exactly. Yeah. But I mean, I can tell when something's looser and when it isn't, but it's interesting when people say that. It's
like, but this is okay. So this is another thing, because we talk about vagus nerve, and I think body work is like one of the biggest vagal nerve activators, because the calmest sleeps I have are when my lymph moves properly or it clears there. Like, so that's a big thing, like toxic load, all of that. And toxic load is higher. And I mean, we talk about in the course, EMF, all of that stuff, but like COVID is so inflammatory, like God knows what else, like we're getting sprayed with, and you know, we don't know the full thing. So that's the other thing in the last 3 years, I think why it's become more obvious is because people have more problems, even like these NHL players that we're working with that are having like severe chronic symptoms that we've never really encountered before with that population, or at least not as frequently.
Yeah.
Right. And
Absolutely.
so you've been seeing them, and then also you see the people that I see online, like virtually, where they have like all the chronic complex illness stuff, and then like I'm the one that talks to them afterwards, so you don't even always get all the follow-up from them. And they're feeling, and it helps them like so much. Like there's usually a day of like die off kind of like herxy symptoms sometimes. We get people to take binders before and after
because you're moving
work,
a lot.
because you're releasing a lot of toxins, because the way our body works is it tries to keep itself alive. So it doesn't keep toxins in the bloodstream. It shoves them into the fascia. It shoves them into interstitial space, which is like in between the cells. It'll shove it wherever it needs to protect you, right? It's like a protective mechanism. And then we're working the fascia to kind of get those cleared out, because that brings down pain and all of that. So that's why we try to get people to bind and hydrate, and, you know, but like even that, like if I think of all the treatment I've done in the past, and I always have gone deep on the tissue, like I've never had someone like, I felt so shitty after, like, because like the toxic load is so much higher, right? So going back to those people where it's helping us be able to get them on more herbs, like get them on more things to kill, because we're getting stuff moving, and it lasts like weeks before they need it again, or like just like seeing the sheer amount of people that you know, when they're chronic and complex like that, it's hard to like get over humps, and it's a big and so that's why I think eventually we're going to have to train other practitioners, because you don't know who you're sending someone to. Like I had a girl that's not close to us, so we can't send her to you. She might even she's going to fly down to see us, right? But she goes to this guy who charges like through the roof. His Instagram looks amazing. Like I'm like, he's got to be a great, like, and he might be, I don't know, but like didn't even like try to attempt to help. Did one thing, said if it didn't help, then it doesn't work, and she needs to do like a ayahuasca or something, because it's all trauma. That drives me insane. I'm sorry. This whole thing of like, someone told me when I was acute, and I literally was having like what felt like life-threatening symptoms, And they actually were when, I started having the troponin higher and that, and they're like, oh, go ground and you have to work on trauma. There's a time and a place for something. And I'm going to rant a bit because it's so annoying, and you're not going to fix someone's vagus nerve that's in full blown fight or flight with intention at that point in time. Okay. Time and a place. There's a time and a place. When someone comes to you and they're acute and they're messed up, like they need some serious help. Like, so that's just a side rant. So, but in tissue, there is trapped trauma, right? So I've had times where you've treated me, Nathan's treated me, my husband, and I like cry my eyes out or something. Like I'm so emotional after. So those things happen even, that happens. You can release trauma by releasing soft tissue trauma. That's my whole
No, I've had that happen with people.
Yeah.
And it's kind of crazy. You're like, I'm sorry, but and they're like, no, it's totally fine. Like, yeah, I've had people cry an entire session, and I'm like, oh my goodness,
and some
feel
people
so
aim
bad.
to do some people aim to do that, like that one practitioner that literally tries to tire out your muscles until you like get an emotional release, or like people that do breath work, anything to stress the body. So anyways, anytime that I've had those type of releases, once you kind of recover from them, because they do release a lot of toxins and stuff too, I mean, that's when you get over this other hump, and like you open up the door for even deeper healing. Because I've been through a lot, but I'll say on the days where I feel clear and my body is not like fighting another layer, like I feel like something has lifted from like deeper within my body and soul or something, right? And like and like I feel like these chronic trap things and all of this, they steal your joy. They affect like your higher connection spiritually, if it's God, whatever. But like, I feel like that was interrupted, and I feel like we see even NHL players and they're relying on drugs or like, weed or whatever, like to like calm down these terrible feelings that you have in your body that are actually trapped toxins and trapped emotions. And we've seen people need to use those things less when they're kind of under our care.
100%. Yeah, absolutely.
Yeah. So, I think lymph is even bigger and fascia is even bigger. And like, we're going to keep uncovering too, like how much we can help people by peeling back those layers for them.
For sure. I just wanted to mention one more point.
Yeah, please do.
Because we were talking about like big kind of stuck points that we've found with people. The third, I would say, really big point is kind of like that behind the shoulders.
Oh yeah,
into
we call
the lats.
The chicken wing in our in our course.
In a non-professional term, it's called the chicken wing. Behind the shoulders and into like the lats. So, for those of you that don't know, the lats come from the low back, like sacrum area, low back, up to inside of the arm. It's kind of an interesting position, but we find that a lot of toxins and a lot of like poor drainage are getting stuck in behind the shoulder blade, and then that's affecting that lat line, and then it can create problems with the lower body associating with the upper body. So you've experienced this, so you felt like you don't have control of your arms, or there's like a disassociation of your arms from your body, and that's because it's like shutting off those muscles. And shutting off the ability to engage those muscles properly. People having like low back issues or issues with their hips, people having, like I said, mid back issues. It's all kind of tied in, but, and then obviously neck issues as well, huge for back of the arm. But more than that, it feels like those spots are really important for clearing that kind of back lymph, and that then ends up draining into the front and then getting out of the body. And I don't think those are necessarily missed, but if you're not looking at those spots, like let's say somebody has a low back issue and you're not looking at the shoulders, or let's say somebody is having issues with their neck and you're not looking at the back of the shoulder, like, I don't know. But if you're not, I think what I'm trying to say is when we are working on people, we are treating the entire body. And so we're always looking to clear all these big points. So we're not going to leave them with like a half done treatment. So if you're like, yeah, I got the abdomen, I got the chest, I'm feeling good, and then somebody goes home and they're still not feeling great, maybe it's because it wasn't enough time to get to the back, and those shoulder points were really crucial for what they needed. And obviously they're not always going to be like the most important thing for certain people, but I think it's always a point that I touch because a lot of people are tight there. And so if you're tight somewhere, chances are your fascia's obviously restricted, and then therefore your lymph is not moving in that area.
Yeah, and that spot also, when it's stuck, even musculoskeletally, like if you think of your ribs, they don't drain as well, and your ribs have so much lymph that are clearing all around your lungs and all around your heart. And you know, and then when you can't breathe properly, then your lymph gets even worse, right? So
I've had people like, honestly, I don't want to say I barely touch them, but like, you know, I do a little bit of work. I work on the front a little bit. I've worked on the back of the shoulders, and they're like, oh my God, I feel like I can take a deep breath. And you're like, I've done maybe 10 minutes. And just working on those few spots allows people to breathe. And like you just said, the better you're breathing, the better you're in tune with that, that's going to also help move things. It's also going to help regulate your vagus nerve and your parasympathetic nervous system. It's also going to help move your lymphatic system. The more you can control that. So if your ribs are so stuck, if you're not being able to get deep belly breaths and actually really get air into your lungs, there's people whose whole practice is based off of breathing.
Yeah,
and getting people better. So if you're not breathing properly, it is a huge deal. And if your fascia and muscles are restricting that, then that is going to be a factor to your healing for sure.
And then all of these things that lock up lymph are so common, and they're getting more common because mold is one of them. And then mold gets exposed to 5G, and then mold creates more spores, and that's known to block up your liver. Your liver makes 80% of your lymph, and then, you know, that's slugged up. And like, so the organ work that we do, that's what you talk about in the abdomen, on the liver, listening for the gurgles, like getting things manually moving to help people move stuff out is like, I guess, even when we're seeing these athletes who don't have any chronic complex illness, like we're protecting them from it essentially.
Well, I think what you've just said, I mean, you've had athletes with problems, but luckily the ones that have come to you, I mean, not everybody, but I think you've been able to prevent not just athletes, but prevent a lot of people from getting to the point where you were. Because you've known how to like nip it in the bud. You're with obviously the supplement protocols, and then how to, you know, work on their own lymphatic system, or how to get treatment, or where to get treatment, or if it's us treating them, whatever it is. I think that combination of things, because you had to go through it yourself, you know how to get them to a point where they're not tipping that bucket over and causing a cascading of a million other problems, which then makes it a lot harder to come back from. Yeah.
And so just to go to her point, because I always realize that people might be listening for the first time, I was really sick with Lyme disease. It affected my heart. I think it was compounded by like COVID vaccine shedding. It was
EMF.
It was also compounded by severe mold. EMF and a big mold exposure before. So what happens in our body is, if our immune system loses the ability to get rid of these things and they accumulate, then you end up with chronic complex illness, which can show up in multiple ways, shapes, and forms. But the one thing that I talked about just briefly was like EMF makes mold more toxic, right? Well, other bugs make other bugs more toxic too. So the stealth infection point that we look into with functional medicine is huge. Stealth infections are things like Lyme disease co-infections like Babesia, Bartonella, Ehrlichia, Mycoplasma, EBV, blah, 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 right? And then that turns on in bugs something called pleomorphism, where bugs that were in your body that were not affecting you in any way now become pathogenic. Okay. Right. But you don't have the ability to go after them because there's too much waste. And then everything slows down, including your lymph. Your body goes into cell danger response. It's not detoxing anymore. those are the ones that we're talking about. We caught those quote unquote early, maybe when they got their first toxic load dump, and we could kind of pull it back. Whereas for me, it took a few weeks to realize I had like acute Lyme had turned back on, and then I didn't treat it right away. And like, there's ways that I do things way differently, based on that. But, the people that we all have stealth infections, right? We all have these things.
Yeah. And if you absolutely.
Yeah. And if you can keep the lymph moving, then this is, say your point now. Sorry.
No, go ahead.
I'm done.
No, all I was going to say was, even for you, I think there were like warning signs, like that at the time, just clinical experience wasn't like, you hadn't gone through it yet. So there were probably warning signs that now you obviously see in other people, or you can recognize for people, that prevents them from getting to that point. Because I think about, you were having, even before this all started, where you actually got diagnosed with Lyme and you had all the issues associated with that before the mold exposure, there was stuff going on inside your body based off of your blood work. Based off of like, you were feeling like, you actually described your like leg as feeling like swollen. That summer. Like in August, you were like, I don't know what's going on. It's like, it puffs up and then it's like, so there was already stuff. Yes.
Yeah. There was
already signs.
But that's the thing. The body is smart, and then it compensates, but it's not clearly, it hasn't cleared the thing. And then it's just an accumulation. Because I was actually just talking to another like young hockey player that's really, in one, because he was doing a lot better, but then he got a COVID infection, which can, like stir stuff up, recreate this like cytokine storm of inflammation. And then he's like, now like looking back, and he's like, some of these symptoms that got returned on, he's like, I used to have this in the past where all of a sudden my toes were a little bit blue, and then it, the next day they'd be fine, and then I'd forget about it. Right. So we have these things, and nobody explains to you what's causing them. Like, we never investigate like toxic load in people. People pay like tens of thousands of dollars for like longevity stuff, or Medcan this or whatever type of like corporate like medical thing. And like, they're never looking at your toxic load. They're never looking at your gut, like where you can actually create health from. Right. But then going back to me, like I was having all those weird symptoms, but then 2 weeks before this all turned back on after an acute mold exposure, I had said, I feel the healthiest I have in my adult life. Like I said those words to my sister. I feel joy. I can jump around and blah, 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 blah. And then it came crashing down, right?
We never say those words now.
No. You know what? Everyone has a grateful journal. The last 2 times I've had my grateful days, like 2 days later, I burned my throat with an oil of oregano. And one day after my other grateful journaling, I fell down the stairs. So I don't know what the universe is telling me. I'm having a hard time deciphering it.
It's just saying you're always grateful and you don't need to like write it down.
Just don't say it, just like be quietly
just
grateful.
Think it in your head. Don't say those words.
Yeah.
I was going to say something else about that point you were making. But yeah, there's definitely always little signs that people have for sure. They just, obviously we're just not, off. Well, that ties back into even, I mean, I want to say it ties back into even being in tune with your body, but like you were in tune with your body. And it was still like, I mean, like I said, now you know, hindsight.
Yeah, but I mean, I had textbook Lyme borreliosis in my brain, neurological Lyme. Like, I mean, if you read a textbook for Lyme and then you were my doctor in 2009, I mean, it's textbook
word for
and
word.
it was missed. And like,
yeah.
And then I suspected through all those next 10 years when I felt fine because your body put it into remission once I got rid of parasites, lowered my overall toxic load. But like, I never knew for sure that I had Lyme. It was like, oh, maybe I did. But it was like so distant in the past that it was like, it didn't really feel real that that's what I had. And then they make it sound like it's so hard to get. And, meanwhile, you can get it from a mosquito. You can get it from sex with a partner. You can get it. It can be living in your mouth and then you get dry socket and then it enters through your bloodstream. Like, it can be in your bloodstream for years and years and years, but it's not in it. It hits the pleomorphism where it becomes pathogenic. Mm-hmm. And then trillions of them are all of a sudden in your body attacking your cells. And then you feel like you're dying. And every symptom can move from every part of your body. And you can have lymphedema at one part and lymphedema at another part the next day. You can feel like you're dying one day, feel pretty good the other day based on how your immune system's taking care of it.
Is the craziest part. Some people who are like, oh, I don't know, it's just like this hurts. And now that hurts. And now I feel fine. And now this hurts.
Yeah.
And it's not consistent. And nobody has answers because it doesn't make sense. Why? Yeah. Well, it doesn't follow this dermatome, or it doesn't follow this this particular checklist.
Yeah. And then I want to rant right now about POTS, because if I see anyone else saying that they have POTS, when like, I mean, POTS is such a specific, like, your blood pressure changes from when you're in a seated position to a standing. And every time there's any cardiovascular long grade symptoms or weird symptoms that people can't explain, they call it POTS. And let me tell you what POTS is right now. POTS is your lymph stuck where it needs to clear over your vagus nerve. POTS is a toxic load issue, but so is every other weird long-lasting symptom. I'm going to overgeneralize it. I'm going to say it with confidence because I've lived through it, because I've seen it, and because if I don't repeat myself over and over, maybe I won't believe it anymore. Yeah. But I'm telling you, I have POTS on POTS. Oh my gosh, I can't deal with it. Also, one thing that it can be too is, you know, people that get Lyme or these toxic diseases, it starts to affect their soft tissue, which we saw with mine. It came from very hard tissue to then all of a sudden hyper mobile. And then, you know, that can put pressure on things like, and then that can create a whole bunch of symptoms. And then there's people that have that really bad, and that's a whole other thing. By the way, you can heal your soft tissue with getting rid of the toxic load, fixing the mineral and amino acid balance.
Before you had your Lyme flare, I have 3 points I'm thinking about right now that I don't want to forget. Before you had your...
Do you want me to jot them down? Here, tell me the 3.
The first one was just going to be about how we've seen with people. I can just say it.
Okay, go.
No, I'm gonna just say.
Just go on.
Before you had your Lyme flare, you your tissue was so stuck and matted, and like hard to move. You were the worst patient.
I know. We have like our least favorite type of people to treat, and like I was one of them for her. So go on.
so carry on. So before you were really bad with Lyme, that's what your tissue felt like. Your like hands didn't move, your wrists didn't move, everything was jammed up. Then there was a period of time during when you were really bad with Lyme that your joints felt like gross. Like I was like, go back to matted because they felt like too loose. And your skin was literally peeling off of your arm. Like you could pick up her skin from her arm. Whereas before it was fully stuck to her bone pretty much. Like it was a complete contrast to before. And I mean, now you're back to, I would say you're not matted and you're not too elastic.
I think
it's like a good, healthy tissue. So, I mean, it's not good to be very matted because obviously that indicates there is something going on at a cellular level in the tissues, whether that's a toxin buildup for any of the reasons we've talked about. But also it's not good to be too elastic and too pliable in the way that you were, because that means that something's like eating away at your tissue.
It does eat away at your tissue. And then also it doesn't hold your organs where they're supposed to be. And then you can get tons
crazy. And then obviously risk of injury because everything's too hypermobile. So it's that weird, I mean, now your tissue feels honestly incredible. You're still sometimes hard to treat, but
let's not get carried away, but we're improving.
It feels way better.
Yeah.
It does it. And even, I mean, we could talk about different parts, but like your neck never moved. And now it's like I can move your neck and I feel like if I do a little soft tissue, it's going to make a change. Whereas before I'd spend like an hour doing soft tissue on your neck and we'd get like a little bit. It was just so stuck and there was so much going on at a deeper level. What I was going to say to that point was, was just that we've had patients who have had underlying things going on. And they've had treatment like every single week. And things, I mean, not that they were necessarily like doing great at points, but things never really like stirred up the same way they did for you. And I think just to that point you were making about how important the soft tissue or the lymph aspect is, I mean, not everybody can do that, but I think it helps to reinforce in our minds how important that is for people, because we've seen it with people who weren't sick, you know, had issues kind of start to happen, but never got really bad because they were getting consistent treatment. That was one of the points I was going to make.
Yeah.
And then the second point I was going to make was just back on what you were saying about how people are experiencing symptoms now like they've never experienced before, and it just doesn't really make sense. And why is this happening now to people? And it just seems very consistent with what people say, like, oh, you know, I feel like I have tightness and I can't take a deep breath, or I feel like I have this rush of anxiety and I don't know what's happening. Because even for myself, I've never had any issues with that type of stuff. And even within the last year, I wanted to just make the point on the abdomen again. Like when we've had so many people, myself included, talk about, and yourself included, talk about like not being able to take a deep breath and feeling like you have like a lump in your upper abdominal area. And that puts pressure on what feels like your heart, because it feels like you're getting this like tension in your ribs and your heart and your chest, and you can't take a deep breath, and it kind of stirs up this like spiral of thoughts of stress and anxiety. And it's all kind of tied back to, I mean, obviously for different people it's different things, but we found when we are working on people's abdomen and chest for those things that it makes a huge difference. And I mean, I felt it with myself, and we talk about when we're sitting in different positions. So if you're sitting at, like, I've had it with sitting in a car and with a seatbelt on and like just feeling pressure sitting in a car and feeling crammed, or I've got it sitting in a theater where they're slightly slanted backwards when, you know, they collapse upward. It compresses your body so into this like flexed position.
It's those seats.
And these things are happening to people, and people might not even realize that those could be like triggers for them. But anyways, I just wanted to make that point because it kind of ties back into what we were saying about big points for people that we've seen that are really bad, and it's like chest, abdomen, and back of the shoulders. And I just feel like, just even sitting here like this, I was thinking about it like, oh yeah, when you're just so compressed in your abdominal section and rib cage, you aren't getting proper lymph flow, proper blood flow, proper breathing mechanics, and it's making people have a symptoms that they've never had before.
Yeah, and like right behind your stomach, or like just a little bit below, is like your cisterna chyli that we were talking about, that drains like the whole lower body. And we think that that's part of the culprit for what just happened to me, where my esophagitis, my gastric problems, like my stomach felt like it was super high up. And because I've had these focal areas of long-term lymphatic stagnation, and one of them was my lower right quadrant, but then that seemed to have cleared up, and now it seems as though it's been more stuck here, and we're having to kind of tease it out. And we cleared these areas, so it actually has places to clear without giving me the jump out of your skin anxiety, which I think is what you were explaining that happens when you're not draining, and especially when your abdomen's compressed because of blood flow to the heart. All of these the things that happen with it. But that's what I called it, jump out of the skin anxiety, almost like sense of impending doom. It's like you want to like rip off something or lose your mind. Like it's like almost electrical, like it's terrible. And I think that part of it is because our electricity, or we're having too much stimulation to ourselves from all of the dirty electricity and EMF we're being exposed to, along with blah, 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 waste from these terrible viruses that were modified in labs and whatnot.
I just wanted to say something. Oh, I think that's, sorry, to your point of what you were saying. So your right hip area used to be, like lower abdominal area used to be really swollen for months. Uh-huh. And then that cleared, and then all of a sudden now you're having this abdominal, like stagnation, upper abdominal stagnation. So
lots of reflux, like lots of pressure right here. Like I have damaged lower esophageal sphincter from so much pressure creating a hiatal hernia.
It's like, you've made this comment before, but it's like when stuff is stuck in your body for so long, it's not just going to clear. It's not just going to one day be like, yep, okay, bye.
Layers, baby.
It's like peeling back an onion. Yeah, exactly. Yeah. It's like all these layers. So yeah, you had months where you'd be like, oh, my lower abdominal area, this is terrible. So swollen. Like honestly, I honestly think it was 6 to 8 months, maybe even a year of you saying those things. And honestly, knock on wood, you haven't said those things in a while. But what happened after that? Now you're getting this pressure in your upper abdominal area. So it's like, sometimes when you have these very complex like issues that haven't been resolved, you get these weird symptoms that don't make sense. But I mean, we kind of see they are following a pattern because we know what to look for. But we've had other patients, same thing.
I wasn't working as much here because it was more down here. Like, yeah, I do a bit there, but like I worked a lot here because of the heart symptoms. And now it almost like it created space for it to slowly come up. And like, I'm not as swollen around my collarbones, and I don't have these big puffs for armpits, other than the fact that I just fell down the stairs and I have a fully bruised armpit because I have great luck. So it's been interesting. It's been a puzzle that we've been putting together in order to, with my complex case, to help other people not be me.
But yeah, my point on that was just like, it's if you are having issues in one part and then that is resolving with whatever you're doing, and then it seems like something else is coming up, it's probably most likely tied into the exact same thing. And
yeah, and you're peeling back the layers,
just having to move it out of the body.
Yeah. Let's go through quickly. My heart was first, okay? And then I felt my kidneys shortly after. And then that kind of resolved. My liver became even more apparent. Sore liver, aching in liver. Then it moved down and it was just my ileocecal valve. Then I had the severe lymphedema here. Then that kind of cleared. It affected my heart again. Then I had long-term edema.
The longest edema
in my right lower quadrant. And now I have it here. So I feel once I get it out of here, since there's room here, and I have been, that I'm going to be better than ever. Ever. But I'm not grateful for it. We don't say those things. Yeah, no, and I do think, like you said, it is about deep lymph, but there are those layers in that deeper level too. So it's like you peeled back at the chest, the heart, and that's actually what I mean. Oh, there was so much pressure here, nothing was ever clearing. So your heart symptoms were first, but nothing was ever clearing here, so it kind of makes sense. You know what I mean? Yeah.
But then, unfortunately, everything was already going on, so it was like your whole body was under attack.
Yeah.
So it was like you had to move all of that stuff through the areas where it was attacked.
But I want to make this relatable, because this is what I don't like for people, and this is what I see people like, like they think, oh, like she's Lyme, she's really sick. Like, you knew me 2 weeks before this happened to me. This came on acutely. Okay. My husband never knew me as someone who was unwell. Like, I'm not a sick person. And I don't like when people, like things can be brushed off with certain people, and maybe you have someone in your family that deals with chronic symptoms. I've always been able to explain mine to my family and to my people around me. But like, if you are someone having chronic symptoms, there was a trigger, there is a way to get it out, and there is a way to get it better. The longer you've been chronic, the harder it is. But you've got to get on top of shit. One thing that I do see is that I would not let myself continue to have symptoms. I would try everything to get myself out of a symptom, because I understood what I understood, but it doesn't matter. When I didn't understand what I understand now, I found answers. That's how I got into this in 2009, when I knew nothing at all. But I had 1 year there, but I had more organ reserve because I was in my 20s. I moved out of a place that was probably toxic, like that I didn't realize I was fixing my environment when I moved out of housing for being in Cairo College to like a newer place. Like you didn't realize that you were doing these things. And then, you know, I get to a place of health for 10 years where I feel like I've overcome something that I didn't even really know what it was. Right. And then I didn't really know it was still hiding in there. So I just want to say, you can be normal and get a virus and have all this shit turn on. So we're trying to tell you, don't let it turn on. Get your lymph moving. Check your stealth infections. Check your toxic load. That's mycotoxins, heavy metals, environmental chemicals. Get on a binder. Work on your liver health. Like, make sure that you have enough nutrients, like the base. That's what we're trying to help people inside and out. Work on your self-care, ground, circadian rhythm, like just start to learn. I always say, like, get biologically interested, stop focusing on everyone else for your own health, and start to like empower yourself. And we're going to try and empower you with our courses. Rant finished.
Yeah, I couldn't have said it better myself. 100%. I think it's overwhelming for people, but you don't have to start when you're sick. And if you are sick, you can get out of it, but you don't have to start. Don't have to push it off because you're not having symptoms. Because at the end of the day, everybody's being exposed to the same things, and on different levels, and all of our bodies
are dealing with it in different levels,
different ways.
Sorry,
and
you were about to say that.
No, yeah, and at some point, and you've talked about the toxin bucket before, but at some point, if you aren't helping yourself out, something's going to happen. Yeah. Whether it's a chronic issue or something very acute, something's going to turn on. And I mean, you hear people have, you know, they don't necessarily have anything when they're younger, and then something happens in their 60s or 70s. That's still a process that had to happen to get to that point. So it's not just, you don't have to live an unhealthy lifestyle, or you don't have to live.
No, I'm not telling people to live in fear. I'm saying you can find these things, take them out and protect yourself. You can find these things, take them out and heal yourself. Yeah. So, and then I just want to tell, I want to tell one quick story of a guy that we were working with, still work with, but he was always like not really that good. His tissue was always really, really bad. And then now he's having like the best year ever, and he cleansed these toxins, and like we tried to tell him about it over and over, but it, you know, things click when they click. And now best season ever, robust, resilient, like huge contract. Like, so performance optimization is a big part. That's all I talked about before I got sick. And now I'm just like looking at it differently. But our lymph course is going to show you tools to help yourself and prevent these things. So that's our whole point. That's our goal. And hopefully we get it across to you really well, where you get lots of benefit from what we share. Yeah. So thank you so much for everything you do. Like, this girl spends everything you do. This girl spends. Listen,
a lot of people would be really sick without you. So,
well, this girl spends, I can't even tell you how long trying to make sure her patients are better. We have to, you know,
because who did I learn it from?
Yeah, it's bad habit. So I tell her not to put herself last, because like I'm like, why did I spend that much time on that guy? And then I got sick. Like, I'm not doing it anymore. So boundaries are also key to health.
That is true.
Working on that.
Something that I can't speak to yet.
Yeah. Well, I'm just trying to get her to not tip over her toxin bucket. So, but you know, we do other things to counter it. But anyway, thank you, Leah.
Thanks, Steph.
She's sort of available for new appointments, but mostly not, because we got to train more people, but we will do that at some point. Thanks for being on here. You're the best.
Thank you. You're the best.
Okay, how do I stop?